My question for you is, you mentioned, I saw you do a twist and you said that for hand pain. Can you talk a little bit more about that?
Oh, it's not for hand pain. It is for overall pain from sitting.
And you said something about the twisting will do something to the brain, it confuses it.
Right. Oh, that has a very, very complex explanation. It's very helpful in chronic pain. Some chronic pain patients go through a lot of physical therapy and see a lot of doctors. And chronic pain is a whole different ball game where it changes. The pain has lasted for more than 6 months to a year. So we have a map of our body in our brain that has different parts of the body represented. And some scans have shown that, let's say if my elbow is hurting, the area in the brain representing that elbow can become bigger. So that has a very complex explanation.
So when you do the twist, it kind of confuses the mapping.
Right.
Oh, that's fascinating. Fascinating.
Right. Yeah, but it has a very complex explanation. But these 3 exercises are easy to throw in because with our modern lifestyle, we have this forward flex posture.
Mm.
And there are, yes, go ahead.
I'm sorry, go ahead, please finish.
There are some wrist exercises that we recommend, which I'm not even showing here because what if one of you has carpal tunnel symptoms, then I don't want to make it worse.
Mm.
Yeah, so.
I find this very interesting. Sometimes I get wrist pain from doing handstands, from standing on the hands and twisting out of them. And I find that I rest it for maybe 4 or 5 weeks and it will stop, but that's my only solution is just resting it and making it.
Gotcha.
Yeah. So maybe these exercises.
On this side? Is it on the pinky side of your wrist?
It's right there.
Okay. I would see a hand specialist. You know, the good thing about technology is there are so many medical systems. I know Stanford is doing video visits. I'm not sure about the other medical systems. A lot of physical therapists are doing video visits if you are concerned. And at times it takes just a couple sessions or even one visit to get ideal brace recommendation and exercise recommendation.
Fascinating. Thank you for your presentation today. It's wonderful.
Oh, my pleasure.
I have a pain in back pain in lower part and it increase upward middle part and in spinal cord. Almost from 1 month.
Okay. So did you do something to aggravate the pain? Like lifting anything heavy, or did it come on its own?
No. Only exercise I am doing.
Okay. You may want to talk to your doctor about it and again see a physical therapist. But there are studies that show that even 20 minutes of walking, again gently, not fast to aggravate the back pain, but very gentle walking can activate some of the core muscles and they can help you. Try that, but you do need specific advice from a physical therapist, and because we spend so much time trying to go for a differential diagnosis. I cannot give you advice, but this apta.org, that website will help. If you look up a physical therapist near you, and when you call, ask them if they accept your insurance. And ideally, a lot of times doctors also recommend, your doctor may refer you to a good physical therapist. In the meantime, you can try and see if a heating pad may help you. Do you have a heating pad at home?
Yes.
Okay, okay, good. That's great. Miss Janaki,
Yes.
and the key is to not sit for more than 15 minutes if you have back pain.
Okay. Okay.
Get up and walk. And I can say this from first-hand experience. I was in a bad car accident in St. Louis, and sitting makes back pain worse.
Oh.
So every 15 minutes, get up. Even if you're watching a movie or something, just get up, stand for a few minutes, for a minute, and then go ahead and sit back down.
And brace is useful for me?
Uh, at this time, actually, as therapist, with the newer model, depending, again, it is we differentially diagnose the exact problem. We don't want patients to get very dependent on brace. It can be recommended if you are in severe pain just for a short time, because what happens is the muscles get used to relying on the brace, the back brace.
Yes.
And you want to get your core muscles strong, your abdominal muscles and your hip muscles and your back muscles stronger. The first step that your physical therapist will recommend will be gentle exercises to improve the mobility. After the mobility of your back improves, they will recommend these strengthening exercises. Because when the core muscles are strong, your abdominal muscles, your back muscles, they can support the spine better.
Yeah.
And so, because unfortunately, because of COVID-19, if you're not able to see a physical therapist firsthand, there are studies that show that even walking for 20 to 30 minutes
Yes.
activates the core muscle.
Okay. Okay.
But ideally, please try to at least talk to your doctor and get a referral to a physical therapist.
Okay. Thank you so much.
Okay, so Saroj, you go quick, please.
I have got pain in my foot bones.
Okay.
Bones which joint your toes to ankle. Those bones are hurting, and in the morning, in the house also, it's difficult for me to walk like a limp. I've got brace.
Oh no. I am so sorry, Miss Saroj. Again, the problem with foot pain and heel pain and ankle pain, it depends on going deeper into the cause. So it may help to see your doctor, because sometimes even if a nerve is pinched in the back, the nerve that goes all the way to the heel, around your foot, it can be from that. So you do need to see a doctor to help differentially diagnose.
I saw my doctor, and she
Okay.
did X-ray, and she said the bones which join near the ankle, I have got arthritis there.
Oh, I see. I see. I
And
see.
so she gave me these bracelets. That is, I have to put this and in the shoes. So I can't put whole day in the house,
Right. That is correct.
For a walk, I put them, and I feel better.
Okay, that's good. A physical therapist may recommend gentle exercises and other heat treatment, or, have you tried a heating pad or soaking your foot in warm water?
No.
Okay, you could try that, or ideally see a therapist so your exercise program is specifically designed based on your X-ray report. And if you are my sister, I would recommend you see a physical therapist. I'm not marketing for my profession.
Thank you.
Because it is very specific, the exercises. It's not just, but you could try heat. And even
leg exercises.
Right. Is your ankle swollen, madam?
No.
No. Okay, that's a good thing. Okay. Because or else you could keep it elevated. And again, motion is lotion. Doing gentle ankle exercises, just 5 to 10 repetitions throughout the day, maybe every hour, you can try and see if that helps. Don't stretch, don't overstretch, very gently.
Yeah, thank you.
Okay, so next one is Kaushalya Ganpati. We have two Kaushalyas waiting, so I had to
Oh,
say.
Shobna is waiting too.
Yeah, I saw you, Shobana. You will be next.
Sure. This two finger is hurting very much. Can you see me? Or
Yes, ma'am. I can see you,
okay,
Miss Kaushali.
okay. This two fingers hurting so much. I can't bend. When I do that, it's hurting so much. It's very big.
Oh,
Yeah, I can't. If I do like that, it hurts.
oh no.
Yeah. First of all, this one now this started also, and this morning I was putting the bandage so that it can help.
Oh, okay.
Yeah.
So I think for you as well, it may help to see a hand therapist using that website, because there can be lots of causes of this pain. It can be either from carpal tunnel, the median nerve getting pinched, or
Yeah.
it can be arthritis. So
It's
ideally,
goes here. So,
yeah, then it can be trigger finger also. So seeing a hand surgeon, not for surgery, but for advice, or at least seeing your primary doctor so she can x-ray it and then refer you on to a therapist. Because based on the doctor's diagnosis, if you have arthritis or tendinitis, your treatment given by a therapist like myself will be totally different than if it is if the pain is from carpal tunnel. In the meantime, you can try to use a little bit of heat. Like we were talking about how motion is lotion. In fact, if you wrap it and keep it immobilized, it can make these joints go stiff and increase the pain. And it can lead to a vicious cycle, of pain not moving. Because of it, joints are getting stiff. And because of the stiffness, the pain is still persisting.
Yeah.
You could try to do gentle fisting and see if it helps. This.
Okay.
But a differential diagnosis is very important, very gently, making a fist and straightening. A differential diagnosis, whether it is arthritis or if it is from carpal tunnel from a doctor, is very important, because actually gripping can make carpal tunnel symptoms worse. So
I
seeing
see.
a doctor for getting a very clear diagnosis is very important. Even a video visit, with a hand specialist. Again, to find a certified hand therapist.
Okay. All right. Yeah. Yeah.
Yeah, but don't, instead of immobilizing it, you want to move the joints gently.
Yeah.
Very gently, within
No,
painful range.
I just keep on moving. I'm trying to do my dishes.
Okay.
I'm not saying a thing. I'm just keeping it like that, like a baby. No, I come to Sachin's class every day.
Yeah, you are familiar. Yes.
Thank you.
Yeah, it was good to see a familiar face.
Today, I like your presentation, and my back below the neck, it was hurting today. And like Sachin said, it is your choice to suffer. So I put my shoes on and went to the park. I came home and showered. And now your exercise were good. Which exercise you showed, they felt good actually.
Right. Because Shobana madam, if you are cooking or using the computer, we are like this all day. So even your walk must have helped, because when we walk, we swing our arms, right? So that helps this part too. So in a lot of our American Society of Hand Therapists seminar, we recommend a 20-minute gentle or brisk walk, depending on your ability, because exercise also helps reduce overall inflammation and helps with pain. Even a good diet helps. So Dr. Sachin's wife is a dietitian. So following a healthy diet can also help with all of you, can help all of you with pain.
Yeah, I'm not new with pain. I have fibromyalgia, so
Oh, I'm so
a lot
sorry.
of time I am in pain, but like I do things, still I do things, and
That is very good.
some days are really bad, but so I can manage. I do manage. I live alone and I have to do my things. So
Right. So
one
you,
more. Sorry,
yes,
go ahead.
you can look into those adaptive equipment like the jar openers and, you know, using a mini food processor to make things easy for you. And for someone like you, we do recommend every 20 minutes, take a break and alternate heavy activities and light activities. So don't try to clean the entire house in one day. Do dusting and then just sit and relax.
Okay.
Then after
Yeah.
1 hour of rest, do a little bit of bathroom cleaning, then relax. You can even write on a calendar. You'll have to plan your activities so you are not overdoing too many activities in one day and aggravating your fibromyalgia.
You are good advice because I don't do that. I do clean, and then I sit, watch TV. So I said, once I finish it off, I'll just sit and watch movie or something. That's what I do. Yeah.
Right. Most of us are that way. My mom was like you, like go. But then you are not alternating activity and sitting. And especially, I can empathize with you for your diagnosis. That's a tough diagnosis to deal with. So you have to plan your entire week. You know, you can even write on a calendar what activities you are going to do. So you are not going to do way too much activity and then just sitting. For fibromyalgia also, motion is lotion. Little bit of gentle motion may help, like the walking, gentle walking.
I do yoga and all that too, but I
Oh,
don't know.
excellent,
I
excellent.
do. And
Like,
one more quick question, if you can. Nighttime, I pull my muscles hand and I don't know what happens. Almost 2-3 times a week, I pull my muscles and it takes time in the bed. So the pillow is the problem and
it
changing.
could be,
Yeah.
it could
I
be.
don't know what good pillows. I'm changing pillows, different expensive pillows. Nothing helps. So I don't know what kind of pillow
Okay.
you need.
I can tell you from my personal experience, you can have your physical therapist recommend you a pillow, but I was recommended pillows by my physical therapist. I bought 12 expensive pillows and tried each one, nothing worked. Then my physical therapist recommended that I should fold a couple of towels to a good height. So my neck is not flexed this way or that way. I'm a side sleeper. So my neck will be in more of a neutral position. And on top of those towels, I put a pillowcase and I sleep. So quite a few physical therapists recommend that. But please be very observant. If it is increasing your pain, go back to your pillow. You know, because with the folding of the towel, couple towels, you want the height to be good and not, so your neck will be neutral. If it's too big, your neck will get overstretched. If it is too small, your neck can get flexed, pinching the nerves here.